This is a continuation of the lecture series on neurobiology and substance use. In a previous lecture, we focused on neurobiology of reward. In this brief lecture, we'll focus on the other effects of substances on the brain. It's easy to overstate the adverse effects of alcohol and other drugs on brain function. As we know, there have been various public health campaigns that have taken this to an extreme. The folks who plan those campaigns may have good intentions, but they have not always honestly looked at the data. To be honest, most drugs of abuse do not have enduring and clinically significant effects on brain structure or function. Functional deficits of the type that would draw attention to the attention of a clinical neurologist are rare. But there are three exceptions to this statement, and we'll talk about those initially. And they are the three listed here: fetal alcohol spectrum disorder, Wernicke-Korsakoff syndrome, and stroke. Fetal alcohol spectrum disorder results from in utero exposure to high doses of alcohol. It is a rare disorder in the United States and Western Europe and the developed world. You can see the prevalence rates posted here, around 1.5 per 1,000 live births. In certain subgroups in this country, however, or elsewhere, where heavy drinking by pregnant women is more common, it is not as rare. 5.6 and 6.4 among Native Americans and Croatians, respectively. We don't know what the effective dose for producing the disorder is. It's quite variable from person to person, and good data are lacking. We do know that the risk for fetal alcohol spectrum disorder is greatest if women drink toward the end of the first trimester. The classic form of fetal alcohol syndrome was described best in the 1970s. It is associated with clear diagnostic features, which are shown here. There are quantifiable deformities involving head circumference and abnormal facial features, such as small eyes, a thin upper lip, and a smoother absent philtrum, the skin fold right here. There are published protocols and cutoff values that can be used to diagnose fetal alcohol syndrome reliably. In the brain of a fetal alcohol syndrome child, there is indisputable evidence of severe damage. Curiously, the damage occurs typically along the midline. A particularly prominent abnormality in kids with fetal alcohol syndrome is agenesis of the corpus callosum. The corpus callosum here is highlighted with an arrow. It is a large fiber tract that connects the hemispheres of the brain. Fetal alcohol syndrome is invariably associated with severe mental retardation in an IQ that averages around 64, whereas the average IQ in the general population is around 100. Like autism, the definition of fetal alcohol syndrome has been broadened in recent years to include a less severe form. The less severe form is known as fetal alcohol effects. Together, fetal alcohol syndrome and fetal alcohol effects form an umbrella category known as fetal alcohol spectrum disorder. In broadening the definition of FAS, there has been a loss of specificity. Some of the milder cognitive impairments found in this broader category may overlap with or be explained by other disorders. Some of the common psychiatric disorders found in kids with fetal alcohol syndrome disorder are conduct disorder and attention deficit hyperactivity disorder. In these children, it is difficult to determine if these disorders are independent of or caused by fetal alcohol exposure. The second syndrome of notable clinical significance is Wernicke-Korsakoff syndrome. In modern society, wherein many of our foods are fortified with vitamins, Wernicke's is a remarkably rare disorder. However, among the homeless or in countries where foods are not fortified with thiamine, the prevalence rate of Wernicke's is a bit higher, but still not outrageous. The reason for this is that Wernicke-Korsakoff syndrome is not caused by heavy alcohol use per se. It is instead caused by an associated thiamine deficiency. If thiamine deficiency is present, Wernicke's is the first syndrome to appear. Clinically, it is evident in the triad listed here. Patients exhibit significant confusion, ataxia, that is problems in maintaining balance and gait, and nystagmus, or eye tremor. If Wernicke's is untreated, then the patient will likely progress and develop what is then called Korsakoff syndrome. Korsakoff syndrome is associated with severe memory problems, confabulation, in other words, making up stories to account for holes in memory, and psychosis. If a patient progresses to Korsakoff's disease, the prognosis is very poor. Only about 40% recover with treatment. The final clinically significant effect of drugs of abuse is stroke. And there are two major forms of stroke: ischemic stroke and hemorrhagic stroke. The prevalence of stroke, of course, varies as a function of the type of drug abused, the duration of use, the severity of use, and other factors. It is more commonly associated with stimulant use, but it may occur among some patients who chronically use alcohol. I'm sure that you've read that low-dose alcohol is in some way neuroprotective, but that benefit is an overstatement for ischemic stroke, and it does not apply at all to hemorrhagic stroke. Alcohol use increases our risk for hemorrhagic stroke. It also increases our risk for falling and head injuries, which can bring about a hemorrhagic event. The more typical neurocognitive scenario seen in drug users is not a cognitive deficit, but a pattern of more subtle impairments that may or may not resolve with abstinence. Most patients dependent on alcohol or other drugs have an IQ within the normal range. They perform well on standard neuropsychological tests because many of those tests are not sensitive to mild cognitive impairment. They were designed for other purposes. While performing more difficult tasks in a research study, patients exposed to alcohol and other drugs chronically tend to underperform the control group on tasks that challenge response speed and visual spatial skills. They may show mild impairment in short-term memory. Long-term memory is usually intact. The area in which drug abusers consistently show a performance impairment is in the area of what's called executive cognitive control. Executive cognitive control principally refers to problems with attention and response inhibition or impulsivity. Executive cognitive control is compromised by many factors other than drug abuse per se. For example, if a patient has a co-occurring disorder, such as depression, attention deficit disorder, psychosis, or conduct disorder, problems with executive cognitive function may occur, and it is very difficult to identify their proximate cause. With regard to neuroimaging, there is also little evidence of severe brain damage unless Wernicke-Korsakoff syndrome or fetal alcohol syndrome are present. There is evidence of minor changes, which are often not clinically significant. There may be an increase in the number of so-called white matter hyperintensities. White matter hyperintensities are bright spots on an MRI that likely reflect microvascular events, mini strokes, if you will. Normally, the number of white matter hyperintensities increases with age and with the presence of a cardiovascular disease, such as hypertension. But the number may also be exaggerated by chronic use of nicotine, cocaine, or amphetamine. Another abnormality seen in neuroimaging studies is a change in tissue volume. Both white and gray matter volumes are reduced in regular substance use. In severe alcoholism, the ventricles may also be enlarged. Fortunately, many of these structural abnormalities resolve with abstinence. Some may remain if they are associated with a co-occurring or premorbid disorder that has not resolved. So here is our summary. Number one, cognitive problems associated with substance dependence are typically not severe. Secondly, neuroimaging studies reveal differences between drug abusers and non-users, which are likewise modest. Thirdly, in rarely occurring disorders such as fetal alcohol syndrome or Wernicke-Korsakoff syndrome, abnormalities in brain structure and function can be severe and clinically significant.